most of the orthopedic surgeries require tourniquet. So it is very critical that your tourniquet application as a preparation towards a good surgery environment is important. So we use gamgees and bandage under the tourniquet, but the width of the tourniquet and length of the tourniquet both are important. You have to make sure, looking at the circumference of the thigh, which tourniquet to be used. If you think that the tourniquet is smaller, don't just put it too tightly and use it. It's better to get another one and use it properly. Get your one assistant to hold the leg, one assistant to wrap the tourniquet properly, and making sure that gamgee or cotton that you use is again wrapped under the tourniquet. Now, very common problem when we do the scrubbing of the leg, the iodine preparation and the moistness goes under the tourniquet and can make the cotton wet. And that is a problem if your surgery is going on for a couple of hours, then the skin can get macerate and get injured. So the one more better way to control this happening is take a small cut in the plastic sheet, get the foot out of that plastic sheet as if the circular hole is snugly fitting the foot, and thigh being wider than the foot, it usually accommodates it very snugly and doesn't allow the fluid to go towards the under surface of the tourniquet. So these few steps will make sure that you are protecting the skin underneath and making sure there are no surgical error or complications happen.